based on the recommendations from the Affordable Housing Work Group, the Office of Mental Health has been involved in really 4 arenas of MRT projects. I'll go through them all first, and then I really want to talk about what we've done this past year in focusing to improve knowledge and education. But the first year we were involved, it was about supported housing. We received 700 supported housing actual units, divided them throughout the state. Here in the city of New York, we have 350 in Brooklyn, 88 for the rest of the boroughs, and the balance of 350, or not 350, 220 some odd in the rest of the state. Then one of our goals with that was, after the RFPs went out and the awards went out, we really thought it was important to fill those beds as soon as possible. We wanted them to really be effective quickly, so we put a self-imposed timeline of 1 year to have them completed, because too often we see that it lingers on a little longer for many good reasons, but we wanted to see what we needed to do to make this work and work quickly. One of the elements of coming into an MRT bed, besides the fact of being a high Medicaid user, the Office of Mental Health, we said they couldn't be housed in another mental health program. So that was important. Well, I'm very proud to say that at just about 1 year, we are 96% filled, which is a huge accomplishment, and we'll talk about how that happened in a little bit. The other 2 projects are pilot projects. One pilot project is about enhanced crisis, enriched crisis programs, taking a look at focusing 36 units throughout the state of New York and saying, how can we attach 1 to 3 units of crisis housing into an already existing program, and then really study that, see if what works, what doesn't, what can we learn from it, so we can make some really measured decisions as we go forward. That RFP has been out. We've received great responses, and we'll be making awards probably within the next month, if not a little bit sooner, because that's almost fully scored. The second pilot, great intent, a little bit harder to get out the door, but we will get it out the door, is really focused on a supplement for services for individuals who are coming directly into supportive housing from institutional settings. What is an institutional setting? In this definition, it would be a psychiatric center, a prison, a nursing home, or an adult home. And what the intent is, if a provider takes a direct admission, we want to provide $5,000 in a one-time to help that transition for that person. We have enough funds to cover 1,200 individuals, and we're working on getting that out the door, making some decisions about how the actual mechanism to getting that to the providers. All of those recommendations came from the Affordable Housing Work Group, came from the stakeholders that told us what is the need. I think that one came from Donna, actually, specifically.
That doesn't work. I'll give
She'll help us out with that. So there was some intent behind the decisions for these pilots as well. And the other piece that OMH is involved in is really to work with HCR. HCR had a capital component, and we tied it with their services only. We had services only projects that were New York 3 here in the city that didn't have capital. So we have worked on a number of projects and continue to work with them on that. Going back to the 700 units of housing, you use the phrase the good, the bad, and the ugly. And that's what, it's one of my favorite phrases, because I think we have to be honest with each other. Some stuff works, some doesn't. We don't know what each other does. We make assumptions about each other's programs when it comes to the different part of the pie we're all attached to. So what we did at the Office of Mental Health is we said, we're requiring that health homes be involved in the implementation of these 700 units. So we brought together the people who were making the referrals, so the shelters, the Article 28s, the psychiatric centers. We brought in the same room with them the health homes, who would be helping create the plans, work with both the referring agencies and the receiving agencies. As well, in attendance were the individual providers that received the awards. And we conducted meetings here in the city almost on a monthly basis, and in the rest of the state on a quarterly basis. Some of the regions in the state didn't even need a quarterly basis because their beds were filled like that. But what did we learn? We learned that we didn't know what the other person was doing. We didn't understand, as a housing provider, exactly what was the health home going to do, what was their role. The health homes didn't understand, what is it that housing does? What should I expect from them? People had different perceptions. People had different expectations. We had very honest meetings, and they were talking about the good, the bad, and the ugly. And when we started a year and a half ago, some of those meetings were tough. They were people trying to be polite, but very frustrated, it got a little heated a couple times. And I can tell you that we had our last meeting this past week because all of these beds are essentially filled. And we did a conversation about what was learned, lessons learned here. And the word that came out continually was communication and understanding, communication and understanding. And really, that's what it came down to, is learning what each other does, communicating with each other, being honest, and really marrying each other's services. In the midst of all of this, going back again to what Liz was saying, I work for the Office of Mental Health, but I also work for the state of New York, and I feel like I'm on two teams, which is wonderful, that I have all of these great partners, state partners now, who we work together, and that didn't happen 3 years ago. I didn't know who that person was over there, and now it's very much a team of people who have a mission for the state to work together to help individuals with disabilities find housing. And so we talked about how do we take the same kind of education throughout the state, because we make assumptions that health home understand housing, and not just mental health housing, but OASIS, OPW, what does HCR does, who's OTDA. So we did 7 sessions throughout the state, and it was somewhat tops of the trees overview, but it was very much a learning experience and teaching experience throughout the state for folks to start to understand the differences and the similarities that we all bring to the table. And again, I love change, so I think we're in a really exciting period of time, and I think we should embrace the fact that we have so many talented people, both as providers and working within the state, that have come together and broken down barriers of working together. So it's exciting. As we move forward, we'll be looking at the different assessments and state needs, as well as the good, the bad, and the ugly, and challenging it, changing it, and moving forward. But I think integration and communication are going to be key.